Welcome to the Medical Insider podcast, where we highlight real-life solutions to your health challenges, incorporate new technology and proven solutions from the past with a healthy dose of common sense, while resisting the pitfalls of idiopathic classifications and economically based medical doctrine. This is your host, Dr. Thomas Santucci. Let's get started. Welcome to this 12th version of the Medical Insider, and we're keeping it as the Medical Insider, even though sometimes we feel like outsiders. I'm welcoming Dr. David Phillips, and Dr. David Phillips is a unique individual because of his ability to kind of go between worlds and still be effective. So this is a guy that received his BA from Harvard in business, went on to do advanced work in biochemistry, has a PhD in psychology, and then later became an MD, doctor of medicine. And then something we were just discussing is that this guy's an inventor. And nowhere in this is a double E. Nowhere in this is electronic engineering. And yet this guy has developed some of the most interesting, effective peripheral neuropathy and other tools that there was. I first became aware of Dr. Phillips when I was told, we're going to meet the guy who invented the world's first infrared ear thermometer. And I was like, okay, cool. That's what technology ought to be doing. So this is a guy who kind of has his ear to the ground, but also in a position to kind of change what we all see on the technical side. Definitely a person's not afraid of crossing the lines in order to get things done. And with that, I want to welcome Dr. Phillips.
Well, thank you. Glad to be here.
Great. So I definitely understand the medical part, the neuro part, and even the business part in your background and education. Can you talk a little bit about how you became an inventor? Because again, we don't see a double E anywhere.
Well, when my wife was 28 and I was 30, we had a janitorial service, and she developed a lump in her breast. And we went through all the process of trying to figure out what it was and couldn't. They're very small, dense breasts, so mammogram wasn't very effective. So the final result was we went to a doctor, and he recommended a bilateral prophylactic mastectomy because we had 4 kids and we weren't going to have any more. He said, if you're not going to, you don't need your breasts anymore, so we might as well remove them, and that way you'll never have to worry about having breast cancer. So annoyed the heck out of me. So I looked at him and I said, do you have kids? And he said, I have 2 boys. Have any more? And he said, no. And I said, well, why don't we cut your testicles off then? And then you'll never have to worry about getting testicular cancer.
Exactly.
For which he threw me out of the office. And I had to then go to actually Northwestern Medical Library and start researching everything on my own from school. So fortunately, I didn't have to unlearn anything at the time.
Nice.
I walked into the library, the medical library, and at that time they had microfiche. You had to roll down and you get one piece at a time and you read it.
Oh, yeah. And you're seriously dating yourself now, by the way.
Yeah, that was, I'm 76, so you can see how long ago. It was 40 years ago at least.
Right.
Anyway, the librarian came over and said, come here. So are you a student here? I said, no. She said, well, this is only for students. You can't come in here. I said, okay. So I walked out, went to the student union, and I bought a lab coat, and I walked back in. And
I love it.
Months, I educated myself as well I could. So I developed a breast cancer detection system that was very effective. She did not have cancer. I had it proven at Memorial Sloan Kettering Cancer Center, kind of by accident. So that's how I got started. And then my father had problems with his feet, so I had to rebuild her. My 4 kids, I didn't want to use a mercury and glass thermometer in the rectum. It was dangerous. One of my granddaughters got a skin disease called molluscum contagiosum. So I invented a device using silver products. Silver kills virus and bacteria.
Yes.
Currently, I'm working on a novel tongue depressor. Tongue depressors haven't been improved in 2,000 years. It's just a stick and a light or a flashlight looking down the
Sure.
So I developed one, and it's patented but not produced yet. That has 3 LED lights on the very end of it. So when you stick it in the mouth, it lights up the back of the throat with a white light. Then it goes through the entire spectrum of colors because each disease has different minerals. Some have more potassium, some have more magnesium, and each mineral will fluoresce or turn bright when reflecting a different wavelength. So it goes through all the different wavelengths. So I can look in there and see, okay, there's some redness, but then when it turns to a green light, I say, oh my God, there's all kinds of splotches. That's strep. And it goes through yellow, pink, and red. And on the red, oh my goodness, there's thrush.
So I think it's so fantastic because
that's kind of what I do.
only it changes the protocol, but it also changes the standard of practice ultimately. That without doing the front door assault that conventional medicine isn't any good, which doesn't look like that approach is going to work. You walk in, provide better tools and say, here's how to do an ear, nose, and throat exam using this tool, not a piece of wood. It's amazing. And then now, I mean, your technology for temperature, I mean, especially with COVID, we were taking people's temperature, as they walk in the door. And then, in peripheral neuropathy analysis, we're taking temperature from the head and comparing it to 5 areas of the body to look for the neuroendocrine part. Without that, we just wouldn't be able to say on an exam that we knew what was going on with thyroid. And it's part of the world now. And so, I mean, you've got to be pretty gratified that in your own lifetime, you built something that, first of all, anybody paid attention to. And then second of all, it really has changed things. It's a big deal. It's not a little deal. Let's talk a little bit about Rebuilder. So you said you didn't want to commercialize it, but I think I'm going to. Rebuilder is a small portable unit, and we used them in our clinic. And basically, my understanding of it compared to TENS or microcurrent, which both have their places, and pulse electromagnetics, it actually is an interactive situation that reads the performance of the nerve and then augments it. So can you talk a little bit about that?
Yes, as you said, there's places for all the other devices, but the way that the brain knows if you have a nail in your big toe or your little toe is a variation in the wave form. You look in the oscilloscope and you watch Frank Sinatra sing My Way, and it's got a particular bunch of squiggly lines. Now, you sing it and I sing it, it goes the same height for voltage, it goes the same length. It looks very similar. However, we don't make any money singing My Way.
That is true.
So it's very distinctive. So what the Rebuilder does, I said, well, we need to find out what's going on. And these nerves transmit signals to the brain, and for numbness and for pressure and for temperature. How the heck does it know that?
Right.
So it just eavesdropped on the nerve signal. So the first thing we did was send a signal from one foot to the other. What the Rebuilder does, when you first put it on, it measures the body mass index. So it knows if it's dealing with like a bathroom scale. If it's dealing with a 90-pound teenage girl or a young woman or a 300-pound athlete. And
sure.
It's a safety standard, so you cannot overstimulate them. And the second thing it does is it sends a normalized signal, average normal. Everybody's a little bit different.
Sure.
But normalized signal from one foot to the other. And then it goes blank, it stops. When, let's say it goes from the right foot to the left foot feels that tingle. And it says, oh my goodness, that's different. I better tell daddy. It sends a signal up the leg, all to the spine, to the brain. That's why you feel it and you know it's there. And it says, hey, something unusual has just happened. Well, when it does that, we eavesdrop and record it. And we see what the waveform looks like. So let's say the waveform is supposed to be a nice, smooth, up and down waveform. But what we get is a bump.
Right.
Say, wait a second, that's not good. So we send a signal that instead of this bump going like that, we send a signal where there's a depression and then continue on. So we neutralize those two, they come together, and we teach the nerve what a healthy signal looks like. And we do that 7.83 times every second.
Nice.
We do that to give the dendrite part of the nerve a chance to recover. When the dendrite, the tiny filaments in a nerve cell that are in the level of the skin and other parts, but it's safe for skin now. When they sense something, they actually bend a little bit. And there's an electrical charge that's difference between the inside of the cell and the outside. There's calcium, potassium, and little holes open up. And where it's negative on the inside and positive on the outside, then these minerals change places,
Sure.
positive and negative, and that tends to keep moving all the way to the nerve cell itself to say, hey, something's just happened. So
So for everybody, back to your basic neurology, that was depolarization, repolarization. I don't think very many people could do that off the top of their head. So keep going.
Well, it takes time for it to recover.
Right.
We breathe in and we breathe out and we relax. The heart beats and it relaxes.
Yeah.
When you walk, one foot's on the ground and one foot is relaxing.
Ah.
It takes time for the body to recover after it does something. So we, instead of using 90 or 100 times hitting a nerve cell with electricity to stimulate it, we do it 7.83 times. So there's a gap allowing it to repolarize before we educate it again. A TENS device is kind of like stomping on your toe so you don't pay attention to your headache. It works.
Yeah.
And if you cut off your toe, then we have a TENS setting on one of our units. You slap it on there until you can sew up the toe or fix it or whatever. But a TENS unit sends a square wave.
Right.
For every person. And it's putting a light switch on and off, as opposed to watching the squiggly lines as somebody sings a song. So that's the first thing that it does. And it does that for half hour and then shuts itself off.
Mm-hmm.
It does is it combines electric muscle stimulation with it, because many people have poor circulation, and that's one of the causes of neuropathy. And if you're stimulating the nerves to regenerate and to fix themselves, then they're going to need more fuel, and they're going to need removal of the byproducts of metabolism. So we stimulate the calf muscles, which is stimulating the venous muscle pump. When the heart beats, it pushes blood away from itself, cuts an artery, and it spurts out in harmony with your heartbeat. If you cut a vein, it dribbles out. So in this case, we stimulate the venous muscle pump to empty that vein. Now we use a foot bath. Put your feet in warm water. The warm water vasodilates the capillaries between the arteries and the veins, so that whatever artery pressure can go through larger capillaries to get to the vein. So they open up those capillaries so we get more blood available to the vein. And then we empty the vein with the venous muscle pump. Mm-hmm. In a nerve cell, you don't just have a single nerve going from your toe all the way up to your brain.
Right.
There's a series of them. And nerves do not connect. There's a gap. It's called a synaptic junction. It's a fluid-filled sac.
Sure.
This electrical signal has to effectively jump across that gap in order to work its way up to the brain. Well, that gap is fluid-filled, and distilled water, for instance, pure water, does not conduct electricity. It needs minerals. So many times if a nerve hasn't been working well, say it's numbness, then the body says, well, I don't want to waste energy holding minerals in suspension here. I'll just let them go back into the blood supply. So now we're sending a larger signal to jump that gap, but it needs remineralization. So there's electrolyte in the water bath so that as the blood goes through there, it can absorb these minerals in the same proportion that's necessary for the synaptic junction. So it can refill that. Another reason we use a water bath is that we drop the electrodes in the water bath, and now the water becomes the electrode. So we're stimulating the bottom of the foot, the top of the foot, the toes, and the area even between the toes. So that's another reason why we do it. We want to stimulate as many nerve points as we can. We want to vasodilate the capillaries so more blood goes through. We want to have electrolyte there so that it can be absorbed to correct any problems in the synaptic junction. And then also the 7.83 sequence of frequency has a tendency to cause the brain to release endorphins into opiates. They travel through the bloodstream. So if you have for the next hour or two, it's a short-term period. If this is accidental, if you have a little arthritic pain or a pain in your knee or your hip or something, it tends to reduce that. And if you use that before you go to bed, it relaxes you and you go to sleep faster. So that's kind of accidental. I didn't design it that way.
Nice. Yeah.
So that's what the rebuilder essentially does. By a 9-volt battery, not lithium, not rechargeable, and you can probably get 100 treatments out of one 9-volt battery.
Right. Our rather simplistic model of that technology was that it actually rebuilt the action potential and then provided the substrates for the neurochemical reactions to happen. So, yeah, I think I could probably say what you just said if I studied it for a year, but
well, you know
we're with you.
What we're taught in medical school is that neurotransmitters transmit information.
Right.
Dopamine and the rest of it. That's not true. What it does is it changes the conductivity of that fluid, the synaptic fluid. So if you have caffeine, it makes it more conductive so that the nerves jump too fast, so you get jittery.
Right.
Dopamine and things like that, then it tends to dissolve some of those out so the signal passes over more slowly.
Right.
Neurotransmitters do. They do not transmit. Chemicals do not transmit information. Electricity in a waveform transmits information. So that's the first thing that is still taught, unfortunately.
Oh, yeah.
About 3/4 of the MD schools. They're beginning to catch up now because I've been preaching this for about 4 years, talking about it forever. But
I think neurology is the last frontier, that there's so much supposition and there's so many general kind of things within the neuropsych world that people aren't really doing the mechanics very much better than we did 50 years ago. You know, my dad was a surgeon, psychiatrist, and I look at the drugs that they were using. They have different names now, but they do exactly the same thing. And then even when we test neurotransmitters or do brain scans to actually change them, and we know what we're doing in terms of our targeting, like delta, theta, alpha, beta waves, when we test the neurotransmitters, it's always kind of a surprise. And then we were using chemistry to fix brains that way. When we used energy, when we used neurofeedback, it worked way, way, way better. So it's not surprising to me that your system comes in and loops that in. That's probably the coolest, most elegant thing about the rebuilder, is that, you know, you can take it at a very base level, but a person doing recurring treatments on that is going to get a widespread benefit. Other thing that's true is it's a reasonably affordable thing that a person can do at home. Some of our technology that we use for peripheral neuropathy are $50,000 generators. You know, it's not, we're clinical. We're not really doing very much at home. So one of the things that I want, you know, people to be aware of is that there is technology that is good that you can do at home. So I have a technical question. How did you stop the rebuilder from habituating the signal and getting the brain to just stop paying attention to it after 2 or 3 minutes?
It changes. After about a minute, the signals change. The signals going back up to the brain change, and we detect that. So we adjust to it. So for the full 30-minute treatment, we're always alternating in what the nerve is doing. So people will start off and they'll put it at an intensity of 2, and they say, my muscle's jumping. I can feel my calf muscles jumping, and I can feel it's really strong. But after about 5 minutes, they start turning it up because the body has adjusted. Yeah. So that's one of the secrets to the rebuilder. It doesn't just send the same signal over and over and over.
Right.
My father had coronary artery bypass surgery, and in that they take the greater saphenous vein out of the calf to use for grafting material around that included veins and arteries. So when they do that, naturally there's pain. The body has to make collateral circulation for the blood, and also cut some nerves. So I grew up in Chicago, and my father was an old Irishman, tough guy, and said, "Okay, Earl, now that you've had this and you're all fixed, you got to get your butt out and you got to walk around the block 3 times." "Oh, I can't do that. It cut me from ass to elbow, and I can't do that. I can't do it. Forget it." So I said, I got to do something for him. That's why I invented it for him. I did not invent it to sell. I invented it for my dad so he quit complaining.
Sure.
And therefore, it had to be comfortable. Muscles have to build up. If you don't use your muscles, you get disuse muscle atrophy. And he was beginning to lose muscle mass in one, which would cause him to wobble and lose his balance.
Yeah.
The other thing about the rebuilder is I wanted it to be comfortable. People can fall asleep with the rebuilder on, and I wanted them to be able to use it at home. If you're going to, you got to diet every day. If you're going to strengthen your muscles, you got to do it every day.
Sure.
If, figure out how to get along with your wife, you better do it every day. Not
That's true. That's a muscle.
You're going to lose that one, by the way. But
right. Yeah. And so the portability is like a huge thing. And then the fact that a person can easily understand the technology, but the technology isn't an elaborate TENS or microcurrent unit because it's actually reading and changing and not habituating the signal is the thing that makes it so effective, from our clinical point of view in the thing. More and more, especially with the remote and the, almost podcast level medicine, we're getting people from Montana going, can you work with me? In the advanced diagnostic stuff in biochemistry, it's easy to do a Zoom meeting. In peripheral neuropathy, it was almost impossible, but now we can do one of these units, send it out to the person, and, you can actually do something long distance, which, post-COVID is, I'd say that was the biggest benefit in medicine post-COVID. We all now can do Zoom meetings from, 6 ways to Sunday. Let's shift, if we would. I understand you've recently embarked on an education pathway for your colleagues. It's something that happens at a certain stage in a person's life and career, and I'm glad that you got to that point. But can you talk a little bit about what you're setting up in terms of advanced education for doctors?
I have created a college called the American College of Academic Medicine, where we teach a full MD course online, and we grant a degree in AMD. It's an MD degree, but preceded by A for academic. Students certify that they will not attempt to practice clinical MD practice unless they do their 1 year free labor as an intern in the residency in a hospital someplace, and they get their license and they pay their insurance, all that kind of crap. So these people that want to write, or they want to teach, or they just want to know what the dickens is going on.
Right.
Now, so we appreciate a practice like yours because you're actually practicing and teaching.
Right.
That's unusual. And you're teaching your staff, you're teaching your patients, you're teaching other doctors. This is why I'm on your podcast, because I respect what you do.
Thank you. It's a tough thing because, we're in an environment where the body of knowledge is doubling every 3 years. So it's interesting to me where people bring up medical protocols like the 4R protocol for gastrointestinal rehab. That was 30 years ago when we did that. It was antecedents, triggers, and modulators on the functional medicine side. So you look at that and you just go, where's the new stuff? And so what's happening in functional medicine? There's a lot of repackaging, and there's a lot of not paying attention to what went on 30 years ago or 50 years ago, especially in oncology and cardiology. And then my clinic has become kind of a mecca for equipment. We probably have $400,000 or $500,000 worth of gadgets in our clinic.
Ooh.
Not because I wanted to, but that's, and then half the things are energetic. And again, I didn't pick that. They just work better. So systems with feedbacks like what you have. And we just interviewed Eric Meldrum from doing the neurofeedback world. And, it's in the day we were using ClearMind and doing brain scans and neurofeedback and getting good changes in neurodegenerative conditions. Well, that equipment cost a third of what it used to cost and is half as complex and can be done remotely. And so all of a sudden we can do a brain scan remotely. It's like I'm not going to stop as long as there's stuff like that available. It's too fun. So, and then like in your world, what we're seeing is, my early training was, I was administering MMPIs when I was 12 years old, like I'm psychiatric. I grew up in a medical family. I'm very comfortable with the way that world works. When I became a doctor, I had so many orthopedic issues that it was a chiropractor that fixed me. So my first license was a chiropractor, but then I had to go study the advanced neurology, and then I had to study the biochemistry, and then now regen. And I look at it and I just go, I'm not that impressed with any of the branches of medicine right now. If you really look at who's acting on the research or advancing things, it's very few people. So, without, making this too sunshiny, one of the things I really appreciate about you is the part that you actually did, rubber meets the road, you don't have formal education for. You became an engineer and your products are super accepted and you won Inventor of the Year. Our whole thing is knowledge is great, but action is where the magic is. And I think it's incumbent upon all of us, especially if we have a big base, to one, give it back and try to not have the next generation, not pay attention to the good things, don't make the mistakes that were made before, but also get some integration and some improvement in the standard of practice. And I'm writing this manifesto on the altering the standard of practice to have informed generalists be the first people that touch the patient and they maintain control. And then it's given to the specialist, but that person has some toys and tricks. And I think technology is going to be huge. And frankly, in neuro rehab and vestibular rehab, your machine at home with some basic exercises is going to hopelessly outclass what is being done currently, for balance rehab in the United States. So it's not like we don't know what to do. It's more like we can't get the people that are doing it to change what they're doing. And so the goodness about a medical protocol based on technology is you go, here's how to do this. Here's how to set up this machine. Would you ever consider putting PMF on top of it as a waveform?
I could, but then, like I say, it would probably complicate the operational of it for a patient at home. And there are other companies that do that very, very well. So I don't need to reinvent. Try to keep my price down low enough. People can finance it for $65 a month. We offer a 90-day unconditional money-back guarantee to try it and see if it works.
Right. A lot of times we're dealing with diabetics, so it is a much more complex, kind of a thing. But even that, the introduction of a 4-day intermittent fast to recreate beta cells or some kind of intervention like that, if the person's kind of at that stage where they can see a lifestyle contribution. But, one of our cliches is that people who want to do everything themselves, that doesn't work in complex cases. People who want everything done for them, that doesn't work either. But it's a combination. It's kind of partnership, but it's not a compromise. So a lot of partnerships are half of this and half of this. It's that you've got to avoid the known antigens. You've got to get rid of the toxins. You've got to get the metals out of the story. You've got to rejuvenate the nerves. And then you've got to make that whole system, jumpstart and have the cofactors it needs to perform. And that's a lot. And what we're finding is we have about 50-50 compliance on that. And again, a lot of this base is 70, 75 years old. So you don't know whether you're dealing with a generalized, lack of frontal lobe function because they look pretty good, or that, it's just too hard to get a person to do that at that stage of life. But I think that's where I love the fact you have a psychology degree because I sort of think everybody needs a psychology degree that's doing medicine these days. And, we'll get a complex case and the front desk will go, that's one of yours, meaning it's a psych case. They say, go do your counseling thing. And I was like, yeah, but my counseling thing will give an image in the person's head that they can get well. And then they will do a bunch of work to fix themselves, because ultimately they're the ones that do it.
I wrote a book that's available on Amazon. It's about using your mind to help advance healing yourself.
There's a lot written on that twilight state, but one of my beliefs is that magic is spontaneous. Some of our best interactions and clinical offerings have been in the shower. They just were flashes. But I think you got to take some credit for that going through, the galaxy of your brain that is an amazing inventor and that can do things, like you should act on your inspirations because the things you're building are really good. That keeps you young, it keeps you vital, it keeps you in the game, all that stuff. But it also is crucial for the world. I mean, we need better medical answers for most things. I mean, all the major diseases that kill people, we've made exactly no progress on from the numbers point of view. Cardiac cancer, diabetes is way worse than it was before. So some of the monitoring's good. The diagnostics are still terrible. It's still an art form. And then the interventions are almost non-existent for the chronic acute diseases. So I keep trying to look at that and going, what can we do? And I really think that the engineering part is the part that has a chance in this environment. If you can put it on an iPhone, or if it's a smaller gadget of something people can control themselves, then I think you've changed the way people are interacting with their disease process. And I think you've done that a few times. So I'm looking forward to your next inventions. So going between the different worlds, because so many times people stop at biochemistry or neurology or equipment, and you've sort of made a canvas of the whole thing. So, and it's really an amazing accomplishment. So we're going to hold it there. I want to thank my guest, Dr. David Phillips, and representing really a new breed of inventor that has the background, has the education, but also has the vision and the oomph to actually get products on the street. So again, thank you so much. Really appreciate your time.
I appreciate what you're doing too. And anything we can do to help you, just let us know and we'll take care of you.
Perfect. Thanks again.
Okay. Have a good day.
All right. You too. Thanks for listening to the Medical Insider podcast. If you enjoyed today's episode, make sure you visit medicalinsider.com. Go ahead and sign up for these episodes. Get them sent directly to your inbox. Do us a favor and give us a like.